Included Health, formerly Grand Rounds and Doctor on Demand, works with more than 250 employers nationally, providing benefit navigation and telehealth care, including now navigating access to abortion for workers in the wake of the Dobbs ruling. Joining us this morning, Included Health co-founder and CEO Owen Tripp. Owen, thanks so much for joining us this morning. You've been working with large employers since the leak of the draft in May. Tell us about how employers are approaching this, those who have said that they are going to have benefits to help workers access abortion care.
Yeah, you can imagine the scramble that most employers felt when they saw the leaked memo, and they knew that they wanted to continue to provide benefits like they had been for decades. But to do that across the state lines and understand the regulatory regime that they would be operating in was quite a challenge. So those were calls that we had in those early days. We continue to supply services to help members navigate to high quality care, regardless of the state that they're in.
Number of employers, J.P. Morgan, Amazon, Citi, they have a mix of white collar and hourly workers. For hourly workers especially, how difficult is this to be able to provide access? They've talked about providing travel benefits, but when it comes to the care itself, the median price for an abortion in this country is north of $450. If someone has a high deductible plan, how accessible is that going to be?
Well, the exact pricing, both to the member and to the underlying plan, in this case, the company, is going to be determined using codes that have already actually been set up and established. That's not the hard part. But figuring out travel to a provider who is safe to make sure that the patient can receive the care both upfront and the follow-up is the really critical part. And so the employers are thinking through how this fits in their existing plan design, and they're adding the travel benefit to ensure quality, safety, and of course, getting that person back in the workforce just as quickly as possible.
How difficult is it to add it with regard to abortion as opposed to travel benefits that they might have for a hip replacement to go to a center of excellence?
Yeah, as you know, a number of our largest customers already offer these services for things like hip surgeries, total joint surgery, or cancer-related surgery. These are care. This is care that we facilitate across the country, care in a lot of cases that we provide directly at Included Health. Now, the actual adding of the services isn't hard. At the end of the day, these are well understood, well protocolized medical services, making sure that the travel benefit works for members in different states and making sure that they can get care after they return to their home state. That is really the critical piece of consideration in this particular change, but really no different than other travel-related surgeries and travel-related care that many of these companies have been offering for a long time.
Now, Included Health offers navigation services, offers recommendations for how to access care with the specialists, but you are also a telehealth provider. What are the complications for Doctor on Demand, particularly when for a number, more than half of abortions are done medically rather than surgically in this country?
Yeah, so our practice, the nearly 1,000 providers that we employ providing care around the clock to members across the United States, we do not prescribe medical abortion, but we do provide a lot of care services surrounding care that would be related to abortion. Of course, that includes behavioral health services, other specialty care, and primary care. Now, for our practice, we make sure that our members are going in person to the care that is both high quality, demonstrated to be safe, where we know that they'll be in good hands and that we can continue to provide that follow-up care. Different telehealth companies are taking different postures on this, but for our providers, we do not currently provide medical abortion.